The Ministry of Health has already begun preparing for when a COVID-19 vaccine is eventually approved. Health Minister Terrence Deyalsingh says this comes following promising developments of 2 vaccines recently. At today's Ministry of Health press conference, Minister Deyalsingh said a team has been activated to look at all aspects of vaccine storage and distribution. Sunil Lalla reports.
Because the Moderna vaccine is part of the COVAX vaccination program under the auspices of the WHO, of which Trinidad and Tobago is a member.
In the past 2 weeks, there have been 2 promising COVID-19 vaccines in trial, one from Pfizer and another from Moderna. According to Health Minister Terrence Deyalsingh, the vaccine from Moderna seems to be a lot more encouraging since it can be stored at much higher temperatures. He said although still in the early days, the vaccine can be stored at -20 degrees for up to 6 months and between 2 to 8 degrees once thawed. Based on this, he said the ministry has chosen 3 sites to store and distribute the potential vaccine, where the Couva Hospital would be the main hub.
Site visits were done yesterday to Couva. We have worked out dimensions. Now we have to go out to get quotes and so on. But my information is the chiller, the walk-in part, could be built very quickly, and we will be ordering the standalone sub-zero freezers simultaneously.
At this time, Mr. Deyalsingh said the vaccine is currently a 2-dose vaccine.
So you get 1 shot today and another shot 28 days later. So we have to be using maybe text messages, phone applications to remind persons when their second dose is.
The minister also gave some insight into how the potential vaccine would be distributed once approved, noting frontline workers, the elderly, and those who are immunocompromised would be the first receiving groups.
After we finish those 3 major groups, then we start to work ourselves down the order of priority into the general population. But there is no plan to vaccinate 1.4 million people.
Mr. Deyalsingh said this country had already paid $1.477 million as part of the down payment to the COVAX facility. Sunil Lalla, TTT News.
No new deaths from COVID-19, but 45 people have tested positive for the virus over the last 3 days. Despite this, the number of total active positive cases remains at 562, the same as yesterday. 38 patients are being treated at hospital, 36 of whom are at the Couva Hospital and Multi-Training Facility, where 3 of them are in ICU and 1 in the high dependency unit. 11 patients are at the Cora Hospital and 1 in St. Anne's. From March this year to now, Trinidad and Tobago has recorded a total of 6,180 total positive cases of COVID-19.